party politics are very much discouraged. We want to state categorically that we don't intend to spoil someone's career nor profession, but rather engage in a very honorable discussion of by Samike Ndisia and Bosco will be our IT personnel. In this particular forum for today, we have leaders that we've invited to be part of our discussion. We have Waziri L, or Dr. Paul Musila. We have MCA Nguma Ward, Meshak Mwangangi. We also have MCA Watertown, Felix Matesi, and we have MCA Mbitini Ward, Ena Mutula. At this particular I want to invite our Waziri to introduce his delegation and also say hi to you. Welcome, Waziri, and be part of this great discussion.
Thank you, Evans. Good evening, fellow members from Makueni County and anyone else who may be listening from elsewhere. My name is Dr. Paul Musila. I am a Waziri for Health in Makueni County. I believe we should adopt English and Kiswahili as a mode of so we'll not assume that everyone can understand Kikamba. So we have with me, I think I have seen my chief officer in the house. I had not yet managed to skim through to see whether any of my directors is in the house. Dr. Ndolo, Stephen Ndolo, have you noticed, have you seen any of my directors?
Good evening, team, and thank you, Waziri. I will share the link and I will be scanning, but if any of them is logged in, can just say hi. Thank you.
Dr. Kanyange, Mr. David Kiruku.
Good evening, Waziri.
Oh, yes. Dr. Kanyange, there you are, the director in charge of, introduce yourself, please.
Yeah, good evening, everyone. James Kanyange, Director HPTs.
HPTs might be Greek to many people. Daktari.
Health Products and Technologies.
Thank you. David, are you in the house? Okay, that's fine. Then we'll run through if Dr. Kasanga and Cecilia join us, then we will be able to alert the audience. Thank you. Back to Evans.
Thank you very much. Thank you very much, Waziri. I expect us to have Felix Mateso, MCA Wote Ward. Mr. Honorable Mateso, if you are present, you can say hi to members. We are also expecting Bernard Mutua, MCA Mbitini Ward, to be present with us. MCA, if you are present, you can say hi to members. So, thank you. I think they will join us and we'll introduce them as they come on board. I think it will be very much important if we move on to our agenda of the day and have our Waziri engaging with the citizens of Makueni County, citizens living outside the country, living in diaspora counties, citizens also living within, and I think the personnel from the health sector within Makueni County. Waziri, here comes the first engagement, and I want you to be assisted by your delegation to help us understand this. I want you to comment on health status and to be specific on universal health care in Makueni County at a time when people are complaining of lack of basic health care, and that is much on medicine. So I want you to comment on it. That is the universal health care and something to do with drugs in our facilities within the county. So that is where we are going to start.
Thank you. Universal healthcare is a big terminology, and we have to first find the ability or the provision of services to Mwananchi. And this is not really specific for the people of Makueni. This is a terminology that is used universally, if I may use that word, basically all over the globe, meaning that the government of the day at the various levels should be able to provide healthcare to its citizens in such a way that they can actually access a certain minimum set standards of healthcare without subjecting them to certain levels of embarrassment, especially the financial embarrassment. So this has been a subject of discussion in Kenya, probably I would say for the last 4 decades or so, from 1978. And various modalities have been tried. Trials have happened. Various people, even before devolution and then into devolution, tried various ways of approaching the provision of universal health care to Mwananchi. So coming back home, we have the Makueni Care, which was started some way back in 2017 as a way of financing healthcare financing to the citizens of Makueni. Remember, I started with contributions for each family of 500, then it was adjusted to 1,000 after reviews of the performance, and that is still ongoing. Then we have the central government now coming up and providing or planning to provide, actually to roll out another program, hopefully to start in July this year, and aiming the same end result of provision of healthcare to all the Mwananchi. It comes with various challenges, and if you look at the universal healthcare, you have to talk about universal healthcare together with what we call primary healthcare, and you have the various components which we all have to appreciate. The biggest being probably the most important being healthcare financing. So there's the costing that has to be done to determine how much is needed, how much is required for a government to be able to provide a healthcare service to every single Mwananchi without having to ask them for pay. Then we have the issues of the healthcare workers, or rather the healthcare providers, starting all the way from the topmost, especially all the way down to the community healthcare providers, or promoters as we are calling them now. And then there is, of course, the other components. So looking at the healthcare financing, that's where the main challenge comes in, and it impacts on all the other 5 components, including the healthcare workers and going on to the commodities. And I'm going there because specifically you have mentioned about, I wanted you to see the linkage between the financing and the commodities, because you have asked about the drugs in the facility as components of universal healthcare. And that is where the challenge is. We are not yet at a level where we can have adequate financing to say we are able to fully cover, but subsequently we keep on learning from the previous budget on how we can enhance the healthcare financing to enable us to provide services at a better level moving forward. Thank you.
Thank you very much, Waziri. There have been outcry among the residents of Makueni County that since the increment of the premium amount that men are supposed to pay, it has become unmanageable due to poverty levels within our county. So, can you just give us some estimates on the individuals who are currently enrolled in the Makueni Universal Healthcare Program so that we can get to know whether we are moving forward or we are stagnating at a particular point? We are supposed to be moving somewhere.
It is true. The numbers have started off at the time it was 500 and peaked at the time around 2019, and then there has been a decline, and many factors. Probably I'm not able to attribute it fully to the increment of the amount from 500 to 1,000. That increment was done after a review of the program. And if you remember, this was done in the review was done, if I'm right, in 2021, 2021. So and implemented in 2022. So this was a review, and as I told you, as I just mentioned a few minutes ago, the review is ongoing. We feel even the 1,000 might not really be sufficient to fully cover the whole family for all the healthcare services that are required to be wananchi. Quickly, before you ask me and what is the way forward, we will have to have a discussion, and the discussion has already begun to happen at the national level, exactly at an advanced level, and that's what I mentioned a few minutes ago about the national government now coming in to provide the services through a restructured National Hospital Insurance Fund, the NHIF. That is what looks feasible moving forward. But in Makueni County, we are not abandoning the Makueni care. We still have our clients getting enrolled onto this. And I'll ask my chief officer, Dr. Ndolo, to, as we continue, pull out the statistics for us to be able to give you the numbers of how many are enrolled at the moment.
Thank you, Waziri. We would also want to know that since as the county, you've said that there are no plans to do away with the program within Makueni even after the National Universal Health Care comes in. As a department, do you have a plan to even ensure that those will be part of the program can even seek medication outside Makueni County, or you'll restrict it within Makueni County? I've heard that there's also a proposal that the amount might go up. As the amount goes up, is there any plan that these can open that members they be in a position to seek even medication outside county? Is there a plan on
At the
that?
moment, but Evans, I'm not sure where you got the information that the amount is about to go up. I want to request for the source of information, because as it is structured right now, and this is what we are providing, we have not been able to promise the Mwananchi that we can actually, with the 1,000 shillings as provided, can actually enable them to use the card to source for healthcare across the country.
Okay, so the issue was you said that the 1,000 might not be even enough. So it was my assumption that there could be plans forward to increase the amount, and the question was whether it can happen. And you've said it well, and we thank you for that good response. Bwana Waziri,
Don't,
you've come with yeah. You've
don't
done
forget the bit about NHIF that I mentioned, which might be rolled out very soon by the national government. If that comes in as planned, then we might not need to increase the 1,000. We'll actually need to interface, and once the NHIF platform is fully established, then we can discuss future plans for the Makueni care.
thank you. Bwana Waziri, you've joined with a bit large delegation from your office, and I think there's been this issue whereby citizens don't understand the work of chief officers working in different departments. I think it would be very honorable and good to the citizens of Makueni County present in this discussion. You at least shed some light on some of the roles that are performed by different CEOs in within your department, so that we can get to know whom should we ask what whenever we have a challenge. So I think that would be quite good.
Thank you. The Department of Health in Makueni County has one waziri who is me. So I head the department, and then I have one chief officer. As I head the department, I'm also the advisor to His Excellency the Governor Mutula Kilonzo Jr. on matters of health across the department. So I interface between the top political leadership and my people, the technical workforce. The chief officer, as you know, is the accounting officer, and for the Department of Health, I have one, and we have one chief officer who is Dr. Stephen Dolo. Unlike other departments, which might be split in terms of the functions, so we don't have a split in terms of the functions at the chief officer level. That is, that's why Dr. Ndolo is the accounting officer for the whole department. Accounting officer means he's in charge of the financing, he's in charge of the personnel as well. And so he reports to me, and he works together with the directors. We have Director James Kanyange, who is in charge of the health products and commodities. That includes the medicine and the other products that are used in the facilities. Then we have Mr. David Kuluku, who is in charge of the planning and overall management. So he's the one who is able now to plan ahead and do even the audits in terms of M&Ts and hiyo yote ni yake. Then we have the Director of Medical Services in charge of the, let me call it the clinical work, actually. The actual work that is happening in the medical facilities, that is where the DMS comes in. And I have Cecilia, who is in charge of the ICT commodities within the department. That's as far as it goes up to director level. I think that, unless you want me to go down a little bit more, suffices.
I think it will be better.
I go down.
Yeah, go down.
The structure includes, as you know, because as I've mentioned, then now we have units. This is all domiciled at the headquarters. That is what we call the County Health Management Team. So we have another number of officers, 24, 25, if I'm not wrong, who head various units within the department at the HQ level. Now, this CHMT works with sub-county teams. The sub-county teams, we have 6 sub-counties within Makueni County: Kibwezi East, Kibwezi West, Kilome, Mboni, Makueni, and which one am I leaving out? Kaiti. So the 6 of them are each headed by a sub-county MOH, Medical Officer of Health. So this is how things happen. So depending on which part of the county you're in, if you're asking me, for example, about some issue in Dongoni, in Ivingoni, Zambani, which is in, Honorable Mutier's ward, and this is Kibwezi East, I am likely to have to call the MOH, the sub-county MOH in Kibwezi East, who is Bana Kakundi, who is stationed at Kibwezi Amre, to get to know exactly what is happening in that particular place. The county is big, and that's why we are officers on the ground. Now, the sub-county teams, MOH has teams also that they work with, and the big hospitals, starting from Makueni, Rufaro, Mbooni, that is in Kikima Tower down there, Kisau, in Bumbune, go up to Kilungu, come down to Sultanamu. There are 13 of them, 14 plus now the MCRH. Those ones have what we call medical superintendents, the doctor in charge of that particular facility. Because they are big, they are managed actually somehow semi-independently. And the medsup has powers now to make decisions within the institution. So occasionally, I'll have to call the medsup directly, medical superintendent directly, to find out how the facility is ongoing. So generally, I think that gives you an overview. The smaller facilities also, they have their in charges. The hospitals have boards of management who are citizens selected from the various regions, depending on where the facility is. And these are the people, the BOM is the one now which assists us to oversight our officers as they continue to provide service to Mwananchi within the medical facilities. So Mwananchi wako involved sana in the board of management or the management committees in the various facilities.
Okay.
Evans?
I think that is quite good, and we are understanding where we are as a county, and where we are supposed to seek what whenever we have issues. That is quite good. I want to recognize the presence of Honorable Mateso. And I'm requesting those not on mic kindly to mute so that we can have a quite good discussion. Kindly, yes, thank you very much. Bwana Felix Mateso, just say hi to members. You'll have your opportunity. Honorable Mateso. Mheshimiwa, unmute and proceed. As Mheshimiwa prepares, I think we also had Honorable Mwangangi, MCM, Ngumo Ward. Mheshimiwa, you can say hi if you are with us. I'm trying to spot the names. Any Mheshimiwa present, you can unmute and say hi to members as they prepare. Thank you. As they prepare, we'll kick off. We'll invite them once they come on board. Thank you very much, Bwana Waziri, for your good elaboration on the structure of the health management in Makueni County. Now, the second question is here with us, and we want to know, recently we've had some complaints from members of public about the ambulances within the county, and many people in rural areas have had this complaint that whenever they have very sick people in their areas, it has been very difficult to take them to the nearby facilities, and there are also claims that some whom their lives could have been taken care of have died as a result of the same. what is the county government doing to ensure equity in healthcare and supply of these ambulances within the county?
Thank you. We have a number of ambulances. We have 11 functional ambulances which currently spread out across the county. Actually, that make that 10 because one ran into trouble just about a month ago. So this is the number that the fleet that we use, and we have spread them out in the various sub counties as I had indicated in the structure, so that if you are near a facility, like if you are near Kibwezi, if you are near Kambo, if you are near Sultan Ahmad, there is an ambulance which you can call and it can reach you depending on where you are. Picking you from the community to the nearest medical facility does not involve you paying. But now if you have to be transferred out to another facility or to within the county or to another facility, maybe in Machakos or in Nairobi outside the county, then there is a subscribed fee as per the finance bill, which is attached to that movement. And this helps us to continue running the facilities. For that person who cannot completely afford to pay that fee, there is a process that is in place. Quickly assess and decide whether it's a genuine request to waive the fee or what is the situation, or partly pay and then partly waive. So those structures are in place. We have done our mapping and we have realized that we actually need a few more ambulances than that. So for this coming year, we have factored in money to see whether we can acquire, and not see, can actually acquire 2 more ambulances and 1 more that is actually in the process of procurement already. So we should be having another 3 ambulances before the end of this year. How many do we need? I will be discussing with the fleet team and with my ambulance managers as we have discussed. And the number that is indicated is actually we might need about 18 ambulances. So we are still short. In this situation, we should have about 18 to 20 for the county. But the finances have not been sufficient in the past, but we'll quickly endeavor to get to that level.
Mheshimiwa, do you think adding 3 more that will get us to 15, if I'm not wrong? Do you think there will be enough?
There will be a significant improvement in the coverage, but we will not have gotten to the ideal number as per the standards that are prescribed from the, for example, the units, the WHO or the Kenyan Ministry of Health. But this is a limitation of the finances. We have not stopped looking for more finances, and the discussion with the top management within the county, finance department, and also the Honorable His Excellency the Governor. We will continue to get some finances, and as soon as we have them, we will avail more to cover the gaps.
Thank you for such a good response. I want us to just get. I ask you some few questions, and then we get to offer forum, because I know members of public have quite good questions that they would want to know from you. This is my next question. We have health staff within a county, and these health staff members have been offering their services on contract basis, with some now on their 3rd year, 4th year, if I'm not wrong. And we want to know the plans of the government on offering them permanent and pensionable terms towards their motivation as they continue with dedicated services to our people. So what are plans on those good members of your team who are doing such good to us? What are your plans and your government?
Thank you. We have various members of staff working with us in the county government, Department of Health, approximately 2,000 of them. I would want you to understand, although this is not something you can pick as you walk into a healthcare facility as a mwananchi, that there are various cadres. About 1,600 are employed by the County Public Service Board. Then we have members of the staff who are seconded from the national government under a particular scheme. And these are on contract basis, which has been 3 years and is now being renewed by the same government, national government, for another 3 years. Communication has come and they don't need to be worried. The ones under the Universal Health Program, it's been renewed for another 3 years. Their terms are slightly different from what is given by the County Public Service Board. Then we have another team of staff who are employed by the various organizations that partner with us in the provision of healthcare services to our county. And these are what we call the partners, or frequently called NGOs. And because they're employed directly by the various entities, their also terms are also different. We have mapped out all these employees. So out of the 1,600, we have about 400 who are not exactly under the County Public Service Board. We have mapped them out. I have the reports. We have begun the discussion with the County Public Service Board on how we can begin to see whether we have space in our current structure as it is to absorb them, funds allowing, see whether we can absorb them into the terms as provided by the others, to the others. This is going to be work in progress. It's a situation that has been going on for the last 10 years also. So it's going to take some time before we can fully rationalize. If you ask me specifically to give you a number of months or years before we can fully implement, I will not be in a position to do that at this particular moment. But we are working on it, and I have the reports with me.
So thank you. So members of public, if you have a question, you can raise up your hand. I give you an opportunity to engage with the government officials present, so that you can get clarified on issues that you have. Bwana Waziri, still on the same. What are the plans of the government on training more health volunteers who can assist our people, especially women who get medical emergencies during pregnancy before they get to the health facilities? Do you have a plan on the same?
We have 3,700 community health volunteers spread across the county, and anchored, basically linked to various medical facilities. If you ask me, that is not a small number. 3,700 of them, that is not a small number. We could, if you feel there are gaps in any particular area within the county, we could quickly do an audit, because it might mean that some of them in that particular unit are not as functional as they should be. And then we can now specifically address that particular region and see whether we need to replace them with others who would be more available to perform the duty.
Okay, that's quite good. But those who have questions, you can continue raising up your hands so that I can support you. We have Mateso, Honorable Mateso. You can say hi to members. If you can hear me, Mheshimiwa Felix Mateso. as Mheshimiwa prepares, Jacinta, you can ask your question, unmute, ask your question, Jacinta Kimuyu, come on board.
Oh, thank you so much, Evans. I hope I can be heard.
Yes,
Good evening, everyone.
good evening.
I have to commend our CEC member, Health, Dr. Paul Musila, for availing himself. Thank you so much, Waziri. We know it's not that you had nothing else to do, but you found time. Mine is very quick. Sorry, can you hear me?
Yes, I can hear you. Thank you, Jacinta.
Yeah. Welcome, Dr. Mine is very quick. I really had to fight for your title to be added, by the way. I value titles. Mine is a quick one on the area of mode of payment for health services. And I'm relating this to an issue which was being addressed on Friday. Thanks. The patient got an ambulance. That one I can say for sure they are functioning. But when it came to payment, because it was being meant from diaspora, there was this element of at one time being told, no, you cannot pay online, it has to be cash. But I told the person who was paying, insist that it has to be maybe a till service or anything else. Actually, it was through insisting that the payment could be done, not sending money directly to somebody. I'm just reiterating, I don't want to cast aspersions, but you may have to press a hard button when it comes to transparency of payments, because eventually I saw an account was paid and I can send to you to Makueni Hospital, a scenario where people had said there is no way you can pay online. And I had to insist because you walk into other health services and, for example, you go to Saitoti Hospital and you are told you cannot pay cash, you only have to pay via M-Pesa or another mode. And you see money goes directly to KCB. So that is an area you may need to put a button and press a button hard, because money, especially when it is public money and is being transacted cash, it can disappear somewhere in between. The other issue is on the community voluntary health workers. Maybe, I don't know the current status, whether they get some motivation fee, because we don't really feel their impact as yet. Okay, we know there are those traditional wakungas who could help even to the extent of getting the baby, and they are paid nothing. Unaambiwa tu peana sabuni ya mkunga kuoga. But are you at a status where you can say, these are the 3,700 and we motivate them? Maybe somebody is on, but I'm okay with that. Thank you.
Evans, would you want me to pick each as
can-
it comes, or you want me to pick 2 or 3 first?
Just respond to that as we move forward.
Thank you. Jacinta, thank you for the feedback about the healthcare worker who was insisting on cash payment. And I think this is where we need people like you in the community, and you should not actually be very polite as you give me such feedback, because I should be able to even inbox me, including the details of the particular healthcare worker who was doing that, because we have systems, we are putting systems in the various facilities that actually are supposed to be utilized. And when we get 1 or 2 probably rogue officers who don't want to follow that, we should be able to get the information, and we should be our eyes on the ground. If you cannot reach me, then you should be able to reach Dr. Ndolo, or even reach the medical superintendent of that particular health facility. So that is something which I agree with you. We will have to put in a little bit more effort to ensure that if it's happening, we get to lay platforms where Mwananchi can report and we can actually take action. The CHBs, yes, as I had mentioned earlier, probably we will need to check if there's a particular region where you find they are not as effective, then we will need to check in and see whether we need to, because there's room for us replacing them. There is a stipend which comes their way. We have been working with the Danish, embassy through some grant and a matching grant where we are able to facilitate them with some small stipend coming their way. We have not been able, and I think we are not the only ones. There's no county which has been able to put them on a payroll, so to say. And this is not likely to happen because of the limitation of the funds, not just in Makueni, but also actually countrywide. So as they agreed to join us, even with a small stipend, they should still be able to give service. And if they're not, then we will be able to see whether we need to reorganize. Thank you. And I'll be reaching out to you. I think I know how to get you to get more information if you're able to provide it without having to say it here in the forum. Thank you.
Thank you
Thank
so
you
much,
very much.
Dr. I have the details, but I would like to say to the members online, we are doing this for the good of the county, not to report anyone, and we are looking forward to the best. Thank you.
Thank you very much, Jacinta. MCA Honorable Meshak Mwangangi Ngumo Ward has just joined us. Welcome, Mheshimiwa. Say hi to members. Mheshimiwa, you can unmute.
Now, I think you can hear me now.
I can hear you, Mheshimiwa.
Okay, thank you. Good evening.
Good evening.
Yes, my name is Honorable Mwangangi from Nguma Ward, which is in Kibwezi West, and I'm very happy to join this meeting today.
Thank you, Mheshimiwa. You will tell us more about legislation on matters health. So
Okay.
you will have your time to tell us more about what you are planning for us as County Assembly on matters health.
Thank you, Chair.
Okay. Welcome, Bwana Nick Mudoka. Your question, Honorable Nick Mudoka. I think former MCA Madi Mdala woman.
Yes, thank you, moderator. As you have mentioned, my name is Nick. I have like 2-3 questions to Waziri. First and foremost, I must applaud and congratulate the good job you're doing in the health sector. I think we need to be proud. I think you spoke about universal health care. And as pioneers in Kenya, we need to be very proud because as everybody is aware, the former director now who is in KEMSA pioneered with the previous government on the universal health care. My concern one, you mentioned about you have a program that is coming in July. I've not heard, have you done any public participation? And you know, July is next month. So I just need to confirm that's a concern to me. Secondly, it's about the ambulance issue that you mentioned that basically what I know used to happen is the public calls the area MCA, then the area MCA calls the health facility or looks where they can get the ambulance. So does the community know about this number you mentioned, Waziri or CEO, that they are supposed to call? As per what I'm aware about, I think if there are those who know that, very few. So we need to come up with a way where these numbers are given to the community. They don't have necessarily to go through the area MCA for them to be assisted. My last question is on the equipment. last week I think I was in Makindu and went there to assist one of area a patient who from Mali, and this plaster thing I think we bought from outside, and also this hiyo wanaita chuma ya kuweka. Why is it that every patient has to get chuma from outside? I think we need to increase the budgetary so that we may cater when ordering from KEMSA. We may order this equipment such that we the patients don't have to go outside and buy. Someone amevunjika mguu and then a big hospital like Makindu, we cannot get a plaster, so we have to get the plaster from outside. So I think when we are in the budget cycle right now, so it's just upon the Waziri and your team to increase the amount, and then once you present to the assembly, I'm sure they will not refuse. They'll be able to accept to increase the budget allocation so that our people might get treatment. Otherwise, so far so good. I must applaud the good work you are doing. And last but not the least, I think you need to look at this thing of confirmation. You mentioned about it of the nurses, those who have not been confirmed. I think majority of them have worked for many years and they are still there. So confirmation means also the issue of to do with budget. So since we are in that bracket of the budget cycle, so look at the figures and see so that they might get motivated and they can serve the people of Makueni. Otherwise, thank you very much.
Thank you, Bwana Nikki, for such quick question. I want to get another question from Benson Milan.
Bana Evans, if
Yes,
you allow me, those who have four,
yeah.
those who have four. So if you allow me, I'll want to address them because it's not one question from
Okay, you
one
can
member.
address them.
So yeah, from Mheshimiwa, when it comes to an emergency situation in terms of calling the ambulance, yes, we will make use of the various platforms to make sure that the numbers also go around again, because we also have the command center at the Makueni County and Referral Hospital, which is able to reach all the ambulances and all the centers within the county. So that's one number. We'll ensure that it is again circulated in the form of a flyer across all our platforms, and the social media is quite effective. Please make sure you save it. But I have no problem with someone calling the Mheshimiwa or calling any other leader that they feel is able to reach me in town or reach any of the other leaders in times of an emergency. Piga simu ile unajua huyo mkubwa, hata ukipigia watu watatu wakoyo maisha, then in terms of an emergency, that is very much allowable. And when the staff issues, as I mentioned, we have initiated, we managed to have interviews done for those who had been shortlisted previously to enable them get employed afresh. Then we also had interviews for those who had been shortlisted for purposes of the results of these will be out anytime from now. The new ones were actually the results out, and we posted them to the various stations a week ago. So you'll be seeing them coming to the stations. The ones for promotion, the results will be out probably in the course of the coming week. And then we, as I mentioned, we are in the process of establishing what other openings there are, and then balancing that with the kitty and seeing how fast we can quickly reorganize in terms of promotions and redesignations for the various cadres that we have. That brings me now to the issues of the equipment. Yes, I agree, because of budgetary limitations, we occasionally run out of essential commodities and clients are asked to purchase. And this is what I was talking about a little bit earlier about the healthcare financing, where occasionally you get actually financially embarrassed as a client, and we would want to move and ensure that this doesn't happen. The implants are expensive. Implants, the tumor hiyo ya kuwekwa. So when we came in, the budgetary allocation was not sufficient. We are working to see how we can begin to narrow that gap. We have begun a discussion with some partners because Makindu, as it is placed, is not really a hospital that is serving our people only. So this is a hospital which is actually supposed to get some support from other partners, and we're in discussion with some of our colleagues who can actually begin to partner with us to make it a center of excellence, even for training purposes, to move it to the next level as a trauma center. We are not going in any way to water down or destroy any of the structures that we found. And I think if you have been keen, we have not done any of that in the last 8 months or so that we have been in government. So the structures that were set, you mentioned specifically by my predecessor, and in terms of the universal healthcare, were not being demolished, and we are not going to demolish them. Even as we bring, except what the national health government is likely to roll out. And this is where now you asked, have we done public participation? We have not yet done public participation about what I mentioned, because we are waiting now word from the national government through the NHIF. But even if it doesn't come as in July as envisaged, of you who interact with government systems, you know, sometimes things get a little bit delayed, then we will be able to continue operating with what we have on the ground, which was established previously, and to await the restructuring. I think, Mheshimiwa, that's, yes, I think I've managed to cover the 4 of them.
Yeah.
Thank you.
Thank you very much. Thank
Chair.
you very much. Precisely.
Thank you. I want us to get one question, then we get the way that is the plan of the county assembly through Honorable Mwangangi, what they are planning for the sector at county assembly on matters to do with the legislation. So Benson Mulanti, you can air your question. Benson Mulanti.
Okay, thank you for this opportunity. And I think without
You are not clear. You can kindly check on your network, Bwana Benson.
you can't hear me. You can't hear me.
Yes, Benson, you are a bit low on the volume, and Chairman has Benson adjust his volume. If you look at the chart, we have provided the number. Dr. Stephen Dolo, my chief officer, has provided the number of the ambulance emergency. So please pick it up there, and you can actually use the networks to actually make sure that it goes to everybody. 0790-777756. That's the number that is on 24/7. And then you will be able to state where you are.
Once more.
Sorry, it's on the chat. 0790 777756. It's on the chat.
Thank you. Thank you.
Okay.
So, Benson, you can
Benson
proceed.
can now be had.
Benson. Okay. Charles Muley.
Thank you, Evans. Number one,
Muley, check on your network.
Sorry, I can't hear him. Is Charles speaking?
We've lost him. As he comes back, we can hear from Patrick.
Yes, Evans.
Yes, yes.
I'm now back. Huh? Some network
Okay.
issues around. Number one, I would like first to thank the ECM for his time. He has decided to talk to us about these matters health Makueni County. I have not much to say, but I would like to put a question on the big time hospital for SGR that Kenya Railways is constructing from Chitwande and Kibwezi East and Makueni people opposite Chale Hotel. Would like to know so far so good. What is the progress? If it is installment or it is still on progress, and if it is installment, what has caused that? And we also need to know when will our hospital be shifting to that place, since we know when Mstwandei Health Center will be now operating from the new constructed hospital. It will be a blessing and a big time to the people of Makueni. So Waziri would like to know the status of that hospital kindly.
Okay, Waziri.
Thank you. During the construction of the standard gauge railway, there are facilities, both private and public, which are affected by basically that project. And just to bring Mwananchi, the rest of the people up to speed, our health facility in Mstwande was actually affected. So as part of that conversation, Kenya Railways basically is embarked on a project that is aimed to compensate the Mwananchi on that aspect. 100-bed capacity, about 120 bed capacity, hospital bigger than what we had previously, and beautifully done. Earlier in the year, as I was informed officially from Kenya Railways, is that financial issues, and I think they are not the only institution that has had to face such a challenge. You have had the discussions around the country on the financial crunch. So we got new commitment from the same management that at the end of June, 30th of June, they will be able to complete the bits that was remaining and then hand over the project to the county government of Makueni. From there now, we will be able to equip it. We have had a discussion with the national government about equipping, and we've got a commitment to that effect. Then staff the facility and then begin the service provision. So we are waiting for the Kenya Railways to finish on the project, and we have been promised 30th of June.
Thank you,
We'll follow it
Waziri.
up. Yeah, we'll follow it up. The Honorable Governor Mutula Kilonzo Jr. is in discussion with the MD of Kenya Railways, and I am aware that there's a meeting that is scheduled soon on the same subject.
Thank you. I think, Charles, you have very well answered by our Waziri. Let us hear from Honorable Mwangangi, part of legislation matters health.
But Evans, Evans,
yes,
as I indicated, I might not be able to stay for the full 2 hours because of some other commitments. So,
yes.
But I have another 15 minutes here. I'll allow Mheshimiwa as I speak. But my chief, Dr. Ndolo, in case I have drop out before the 2 hours, then Dr. Stephen Ndolo will be in the house to pick up any matters that may arise. And I am here for another 15 minutes.
Thank you, Waziri, and we are very much happy for your presence. So, Mheshimiwa Mwangangi, you can tell us the plans on legislation on matters in our county.
Bwana Evans.
Yes, Jacinda.
Maybe a quick one before we go to the legislation. Why can't we finish with the Waziri within the 15 minutes? Because I have something burning which would need the attention of the Waziri himself.
Okay.
Can I proceed?
You I will
Just a
ask
quick one.
my
A quick
honorable
one, and
member.
this one is being pushed to me by the public to ask.
Thank
Maybe
you.
a quick one.
You can proceed.
Yeah, Bwana Waziri, I'll not do you any good if I don't ask you what the public is inquiring. And there was an issue which was highlighted before we call it politics about the effluent from our mosques, which is going to Kaiti River, true or false, but maybe people are saying they would want to hear the position from you yourself. Thank you.
We have a facility which serves to take care of the liquid waste from our big hospital in Makueni County and Referral Hospital. This was constructed some time back, probably around the time many of us were being born, around 1979. And such facilities require frequent servicing and maintenance. Unfortunately, this has not really been happening. And we managed to address that issue when it was raised. As we went through the system to basically unblock the blockage that was there, it is unfortunate that we were able to realize that everything that we found was not really accidental. I would say it's unfortunate because it's something which I did not expect to find some 20 huge blocks hizi za mjengo zimewekwa in a manhole kuzuia maji isiteremke. So this is a fact, and we got them out. We have since addressed that issue, and I'll be willing to accompany or to be accompanied by anyone who is available nearby so that we can take you through the lagoons. There is the permanent the blockage that was there.
This
It's unfortunate that sorry, there's someone who is on echo. There's now a more permanent solution that we are working on, and we will be able to do this as soon as we are done through the new financial year in terms of the budgeting. So this is something which will service now the whole system from the sock pits all the way down. So it's already sorted. If we walk in there, you will not see what was being reported, and we will ask that Mwananchi also continues to be our eyes, because this was unfortunate that somebody can actually sabotage a public facility to that level. We are putting money to also fence off the field to make sure that the access is limited. Thank you.
So thank you, Waziri. Patrick, can you ask Waziri your question? Patrick Muidhia.
Yes, can you hear me, Mr. Evans?
Yes, I can hear you now.
Yes, my question is very quick on matters of how is the county government ready to improve on the services of the ambulance services, because we have little of them, and the last time that I checked was we have the ambulances that are not in match with the current vehicles that we need.
Patrick, I think we've lost him, and I think the question is asking Waziri had talked something on the same. I don't know. We'll brief him on the response of Waziri on the same. Mativo, you can ask your question as we get to the next session. Mativo Bernard.
Yes, thank you very much, moderator. First of all, I want to begin by applauding Waziri and the other leaders for taking their time and showing up. We really appreciate. Now, my question goes to Waziri. Many diseases are as a result of malnutrition and poor living habits. How are you aligning your operations to combat malnutrition among our community? Prevention is better. And to an extent, maybe, are you collaborating with the Department of Agriculture to combat malnutrition among our community? Thank you very much.
Thank you, Waziri. You can answer that.
But Mativo, that's a very good question. Health comes in various ways in what I call downstream. Basically, if you just sit in the hospital and wait to manage matters of health, then you have lost actually the chance, more than 50%, probably 70% the chance to intervene. So you're right. We have to go upstream and begin to address issues at that level. We have the concept of what we call the One Health, and we have mobilized ourselves. I, Waziri Agriculture, that's my colleague Joyce, Waziri Water and Sanitation, that is Engineer Kieti, and Waziri Environment, because we need to have a clean environment, we need to have clean water, we need to have food, proper nutrition for our people in order to make sure that they actually don't get sick. So these discussions have started. We have factored in the various activities that need to be put in place. If you look at the manifesto of His Excellency the Governor, Mutula Jr., you will realize actually agriculture comes as number one in our priority areas, and water comes as number two, and then health as number three. It's deliberate. And I know this because I happen to have sat in one or two places where the manifesto was being drafted before the final copy came out. So yes, we are aware of that, and we are deliberately addressing the various aspects that need to be addressed before to make sure people don't get sick. Thank you.
Thank you, Waziri, and we really appreciate you for coming. Kindly those on mic, and if you are not on thank you. So I'm saying that Waziri, we appreciate you for coming and giving us quite good information that majority might be lacking. I want to tell you that this program is live on TVL News, and we currently have around 300 citizens from Makueni who are following. On this platform, we have around 50 members who are following, and I think information is power, and once it goes to the public, they get enlightened. We'll invite you for quite many forums to shed light on issues that might be of concern to the public. Our interest is to see a very healthy community, a very healthy county, and with all that, I think as a county will move forward together, because health county means a developed county. As you leave us with your CEO, we appreciate you very much. So I think you can say your last quote as you exit.
Thank you, Evans, and thank you for making me aware of this platform. About 2 weeks ago, sorry, I could not manage last week as we had initially planned, but I am here and will continue to interact. I have a team that is able to address any issues that may arise from time to time in case anyone is not able to reach me. My number is public 0722-256-372. So you're able to reach me on that line. I only have one line. I don't switch off that one and go to another one. So as long as we are working in Makueni County, we are working for the citizens of Makueni County, and I'm ready to give it my best and tushirikiane tuhakikishe kwamba ile shida ambayo iko kwa wananchi wetu tumeweza kuitatua. We'll continue to bring in the various other programs that your heard us talk about. We had the we had the surgery for basically from the neurosurgeons that we managed to have some 2 weeks ago. And then we are planning on having an eye surgery clinic coming up very soon. We were hoping to have it towards the end of this month, but because we are collaborating with some surgeons from outside the country, we have they have requested that we have it in August, and we are obliged to have that done in Makindu sub-county hospital in August. Other clinics will be announced as we move on, because we want to be able to provide the whole spectrum, all the way from the community to the highly specialized services that we know are available and are accessible elsewhere, but have been a challenge to our people. But tutazileta nyumbani. Thank you, and God bless you all.
Thank you, Waziri. Our discussion continues. We have the Chief Officer with us, and Dr. Ndolo Stephen, together with the other team of officers from the department, will be in a position to take up the questions from the public as we proceed. At this moment, I want to invite our MCA, Honorable Mwangangi, to give us the stand of the county assembly on the matters health care. So welcome, Bwana Mheshimiwa, and give us the position of the county assembly on legislation on matters health. Bwana Mheshimiwa, we can't hear you. You can unmute. Check your mic. I can't hear you now. Check. We can't hear you still. Can check the mic.
Can you hear me now?
I can hear you now, Mheshimiwa.
Thank you. Thank you, moderator. If you can hear me. First thing is we know as the assembly there were a problem in our health facilities, and we have been following keenly as the assembly so that we can make sure our people get services. And to start on last week, we met with the Excellency the Governor concerning the health matters, and another thing concerning about these modern health facilities, because we agreed with the Governor in every ward. We have to put one modern hospital that will which will work 24 hours to make sure our people get services. And another thing, when we met with the governor, we agreed in the ward level, the modern hospital, the headquarter will finance everything. We'll put money to make sure we get medicine, because we know there is a shortage of medicine and all that. So one thing we agreed with the governor is to make sure our modern hospitals, there is enough drugs to our people. Another thing we agreed is in the future, or this year or next year, because there is challenges of finances. If we can have, that is a request we ask His Excellency the Governor, if we can have ambulance in every modern hospital, and if we have ambulance in every modern hospital, that ambulance will be able to help our people. If our people are sick at their home, those ambulances will be able to go and pick those people and bring them to hospital, because that modern hospital will be working 24 hours. Another thing we asked governor to consider it is about the dispensaries, because you see, for example, let me give for example within Ngumo we have two health centers and 2 dispensaries. So one thing we asked governor to check on if we have one modern hospital in every ward, another health centers, if they can work from Monday to Monday, because most of the hospitals, they work from the health centers, even the dispensaries, they work from Monday to Friday, or from Monday to Saturday. And people get sick Monday, Saturday, and Sunday. Sometimes our people, they suffer a lot. If you go to your health center or in your dispensary and you find it's closed. That one we agreed with the governor to check on that, so that our health centers, our dispensaries can be opened from Monday to Monday. Another thing we agreed is about drugs. The last regime, they did the minimum of the medicine that they supply in every health center, in every facility. And we, as the assembly, we did public participation to all the health centers in Makueni County. And we find the medicine they supply in every health center or dispensary is about 140,000, which those drugs it is supposed to take about 3 months, which is quarterly. And because we work very closely with the ECM, we have our subgroup with him. Everything and every time there is problem or challenges in our health centers, we consult, we talk, and Waziri acts immediately. What is there is to make, what we are trying to do as the assembly is to make sure our people are not going to die, because we are on the ground. We are on the ground every 24 hours. Maybe Waziri and the CEO, they are in the water or in the offices. But we, as MCS, our work is to make sure there is enough medicine, there is water in the facilities, there is nurses, there is these there is services. One thing we have agreed is with the governor is in our hospitals is to add nurses, because you find, like many hospitals, you find there is one nurse, and that nurse is to take care of everything. You find there is people there sick. There is another mama there want to get to deliver. And when we were asking them questions, they tell us when they have people on the queue waiting to be seen by the nurse, and there is a mama there has come to get a child to get delivery. They leave what they are doing to help that pregnant woman to be helped to get delivered. So what we talked to we discussed with the governor last Monday is to add more nurses to the facilities so that our people can get services without delaying. Another thing we are trying to do is, you find in a most of our hospitals or of our facilities, the roads are bad. Then what we are trying to do is to all department, ECM Health, ECM Road, ECM Water, to work closely to make sure in all hospitals we have good roads, in all hospitals we have water, because there is some facilities where they have no water, they buy water. And this is our proposal, and I know because we are compiling the report on health report that we went around on the whole assembly. We propose that in every health center to have a borehole there, because sometimes you find like Sumele, they have no borehole, they buy water. Sometimes the water there is no water, and there is no money to buy water. Sometimes we intervene and buy water. I've bought water several times in Sumele, so it is good, and we have agreed with the governor to, when the report will be reaching him, to act on that, so that our people can get water, because they use a lot of water. If the facility, they can have 4 or 7 people, 7 women are coming to deliver. So what is there is we are trying to tell the governor the problem, and we discuss about all that. And the governor he promised the assembly that he's going to work on that. He's going to make sure there is enough medicine. He's going to make sure there is good roads for the facilities. He's going to make sure we have more nurses, so that the work can be easy. And after that, we discussed about this modern hospital. And the one thing we agreed with the governor, because with the assembly, the money we get, we were allocating the money. But when we met with the governor, we agreed everything to be health facilities to be catered by the headquarters. So I think moderator, we discussed a lot of things. So what we are trying to say is to Waziri to add more money in medicine, because this story of there is no money, there is no drugs in our facilities. We want that one to end this year, because I know that the government was new, but what we are trying to tell the governor, because now is there, to make sure there is medicine in our hospitals, there is services, and to make sure everything is good. Back to you, moderator.
Thank you very much, Mheshimiwa, for quite good insights on what you as the MCAs are trying to do with the executive wing to see good health facilities catered within our county. Those are questions. We have our officers with us. and they will be for answering. Munyoki, kindly.
Yes.
Munyoki, can take your mic off. Also, you can still check on those who are on mic, and then so that we can move on well. We have a question from Nikki Mudoka. Nikki Mudoka, come on floor.
Thank you, moderator, once more. I was listening to Mheshimiwa, and he has extensively discussed more about what the assembly is planning to do. Mine is not criticism. I think more. I expected more on legislation matters, and more on because basically the work of the member of county assembly is to legislate, oversight, and the issue of budget also, which comes on board. So at the bottom line is to come up with motions, policies that will enhance what the discussion is all about with the governor. Because meeting the governor is one thing, but the only thing that can be implemented on the request to the office of the governor is through legislation. So I think what they need to do is to come up with policies and pass at the assembly that, for example, they need every facility in the ward must have a borehole, and if that is passed and money is allocated, then it will be implemented straight away. So I think they have a good agenda. If it is put into legislation and paper and passed, then it will help the people of Makueni. And also, I must appreciate the point on making sure that every ward is a working facility 24 hours, such that we don't have to see our people trying to cry overnight, trying to access the facilities. Finally, it's about Mombasa Road. Mombasa Road, you realize from Malili to Mutituandei, we're catering more on people from Makueni. So I think when it comes to budget, they need to put a lot of money to cater, and especially we don't pray for accidents to happen along Mombasa Road, but we need those facilities being taken care of and put more money, such that we don't have to have referrals and seeing ambulances, from Emali, from Ngumo, going all the way to Machakos or to Nairobi. So we need to see a lot of money put. I appreciate the governor is putting a lot of effort in agriculture. So at the same time, let us not overlook on the health sector, because our health is very important. Once we have a health nation, then once we have health residents, then we have a health nation as well as our county. But otherwise, Mheshimiwa, congratulations on the agenda you have, plus
Thank
your
you.
team. Thank you.
Thank you.
Thank you very much, Bwana. Kindly, Amos, Amos Kilonzi, kindly take your mic. Bwana, those who are on mic and Lord off. Bwana Amos, that is also check on that. Thank you. We have a question from Damaris. Damaris, please, what's your question?
Okay, good evening.
Good evening.
I want to ask a question regarding the model health centers. I don't know whether Mheshimiwa is here. I can see he has moved aside.
I have come back using my phone, so you can ask the question on the model health centers, please.
Okay.
I have
Yeah,
logged back in as I move.
all right. My question about the model health centers. I have heard Mheshimiwa talk about the plans that they have about the model health centers, and he has talked about the ambulances. He has talked about the trucks. There is some noise. There is some. He has talked about the ambulances. He has talked about the trucks, and he has talked about additional staff, particularly nurses. Most of these facilities that are already earmarked to be upgraded to the model health center status are already operational, and they have been operating, but maybe to a lower scale. And in the world that we are living in currently today, no one wants to have their health experimented or their bodies experimented. What do I mean when I say that? I am talking about we are investing a lot in these model health centers, yet we are not investing diagnostic services. When you go to an hospital, most people are leaving these facilities and going to the level 4s because when they go there,
well, we are not getting you clearly.
You aren't getting me.
Yes, now we are not getting you clearly.
Okay, let me.
Now
Getting me?
Proceed. Now we can get you.
Okay, I was talking about the plans that Mheshimiwa has highlighted about the model health centers. He has talked about the ambulances. He has talked about equipping the model health centers with drugs, and he has talked about additional staff, particularly nurses. But when I look at what is lacking in those model health centers currently, which are already operating as dispensaries or level 3s or health centers currently, one of the reasons that our people are bypassing these facilities and congesting in the level 4s is because they are lacking diagnostic services. When you go to an hospital, you do not want to be treated in a way that you do not understand why you have been given this drug, why you have been treated this way. It is because people have confidence when they go to the level 4s, they are diagnostic facilities. They are able to be told, I have this and this, and I am being treated for this and this. And so even when you listen to Mheshimiwa, they do not talk about the diagnostic services, particularly the laboratory services. So I want to submit that in as much as we want to bring these modern health, model health centers, our people will still continue to leave them and go to our level 4s and to our big hospitals because they lack the capacity to tell them, what am I suffering from? You know, that is the confidence that they want to hear. And so I want Mheshimiwa and the rest who are stakeholders in this thing to go and consider upgrading the laboratories in those facilities, because we may invest a lot of money in these hospitals, and at the end of the day, they do not serve the intended purpose. And the intended purpose is to decongest. One of them is to decongest our level 4s and make them kind of referrals for these model health centers. So if we do not consider having laboratories and equipping those laboratories to a capacity that they can diagnose and tell somebody you're suffering from this and we are treating you for this and this, they'll continue being shells of hospitals that are not realizing the reason for them to be there. So please, Mheshimiwa and the team from the Department of Health, please consider this and have laboratory staff in those model health centers so that they can serve the purpose that you want them to serve. Thank you.
Thank you very much, our brother. Then we have Kilu. You can give your question so that they all got answered once. Kilu.
Can you hear me?
I can hear
Hello?
you. Proceed.
Yes.
Proceed.
My question is about the antivenom drugs. Are they available? Back to moderator.
Thank you. Jacinda?
Thank you so much, Evans. Mheshimiwa, I greet you. Mheshimiwa MCA Gumo, I greet you. I'm glad to see you. Niwe MCA Wamba Mama. Now, my question is just a quick one on the area of oversight. Legislators, you are the ones who are charged with oversighting the executive. And when you don't do it well, the people feel like they have been neglected. My question is, where is the missing link? Because there's so much outcry on the ground. For example, when you talk about the issue of health, people are calling and saying, I've been to hospital, I've been told to go and buy medicine, I have no money. In fact, I'm getting so many phone calls from even strangers thinking I'm so rich and I have money to sponsor people to go and buy drugs. The question is, we see Governor Mutula Kilonzo Jr. flagging a whole vehicle with medicine. That medicine is going to the facilities. Then at the same time, people are being told to go and buy medicine. As the people charged with oversight, are you really keen to know where our medicine is being spent and whether it's being used by the people? That is one. Number two, when it comes to the facility, even some basic things like maybe clearing the bushes. You see, this is a medical facility and it's covered by grass and thickets. Then you ask yourself, are there any people who are usually attended in this facility? The people doing oversight, where is the disconnect? Thank you.
Thank you, Jacinda. Muteti
I feel
Jr.
like we have lost Mheshimiwa. I don't know where.
No, is with us. We will respond to the issue on oversight. Muteti Jr.
Good evening, everyone. I hope everyone is doing well. I'm Mr. Gideon Muteti. I'm Mr. Gideon Muteti. I wanted to maybe chip in and ask a question on the system that the governor was talking about. If I'm not wrong, there is a system that is put in place to control maybe the issue of drugs in the county government. As we all know that when a system is new in a place, it is very hard to have it effective. So how far has the county government gone with the system, and maybe how effective is it? Thank you so much.
Thank you very much, Bwana Muteti. So we'll have Mheshimiwa and Waziri responding the issue of model facilities that are being constructed in every ward, and Waziri, that is the MCA doing the oversight part of the question on board as we close this chapter. Onesmus Mwema.
Thank you for saying, moderator. Now, one of us has asked something about the system that has been adopted to enhance issuance or supply chain transfers of medical supplies. I would also wish to know how effective this is. Then number two, if I may ask, there was a suggestion that medical supplies were to be supplied from the main contractors or providers of medical supplies direct to the dispensaries and the other centers or the hospitals. Now, I would wonder how effective that is when it comes to accountability. And number two, would it not have been efficient enough if probably this was utilized under the headquarter for the supplies to be remitted to the AOD centers or dispatched from the head office, that is the county headquarter there, to the various medical outlets in the county, other than, for example, having KEMSA transfer medical supplies from from the Nairobi depot to the various medical outlets, in which case you would even realize that at times the receipts were done as late as 7:30 in the evening. I remember there was a case that I witnessed somewhere where receipts were made or received or done at 7:15 in the evening, and that was way too late. So you cannot even establish if really the quantities that have been described in the relevant notes is what has been received against. Thank you.
Thank you. So let us start with Honorable Mwangangi responding the issue on oversight. Then we shall have Waziri doing the other questions.
Okay, thank you, moderator. One thing I want to tell members is that this year, governors put a lot of money in health facilities, because governor is aware about the challenges and the problems our people are facing. And when we were talking with the governor, Mother, you know, in the hospitals there were drugs, many hospitals there were drugs, and other people they were selling those drugs. Like now, when Waziri can bear me witness, we have a case in Kalanzone, in Kimakiu Kalanzone ward. In last 2 weeks, the area MCA, he was told by somebody, there is man who comes anytime we supply him those medicines. There is somebody comes and they took those medicines and go and sell where we don't know, because that case is in the police, and maybe Waziri or the CEO, they can can tell us how far they have gone with the case. What we are trying to do is the in charge of the health facility to be responsible in everything, because sometimes we have medicine and that medicine it disappears. Yeah? We have that case and we are following. And the one thing, because there is the report that we wrote, and I think because we were in recess, I think this week Governor will have that report, and I know we'll act on that report. About modern hospitals. Modern hospitals, we said before somebody from maybe Makendo sub-county, before you go to Makendo, if you feel sick in Ngumo, maybe in Isumile, and we have in our laboratories, there is everything. We have all machines in our level 3 hospitals. So when we are saying we are going to have a modern hospital, somebody to go to Makendo will first of all to be checked on the modern hospital, because that's why we are proposing to have ambulances in all wards, so that our people can get services. That one is taken care, and we have a very good report. And I know when that report reaches to the governor, we will work on that. And last regime, what they were doing, and I want Waziri maybe to think about that. Last time when they were regime, they were, for example, Makendo was the feeder of the level 3 and the dispensaries. Right now, every health center, level 3 and the dispensary, they depend on themselves. When they get their medicine, they manage their medicine. When they finish their medicine, they stay like that. That report we wrote and asked why. Now why that is happening, because like Elato Health Center, because that's the one we are proposing to have to be to be modern hospital. we are requesting that modern hospital to be feeder of the other hospitals, so that the Waziri and the CEO can manage well about the medicine. They can manage everything, so that this way of people selling medicine, people selling drugs, that want to finish that problem. And I think, moderator, about money, about what I was saying about you see, when we went there, we find quarterly they were allocating grants for worthy 140,000. This year, Governor and the Waziri, they have put a lot of money in our health centers. And I know this sort of lack of medicine, lack of drugs, lack of a lot of things. That one that story will be finished, because I know we can't be oversighting the health centers without medicine. And when our people go there, when they feel sick and they find there is no drugs, they tell us, sasa tumeenda huko na hakuna dawa, sasa tutaenda huko, nimeenda nikaandikwa nikanunue dawa. So we want to finish that thing, so that when our mama there go to any other facility, even if it's dispensary, even if it's the level 3 hospitals, we want the government, we told governor to equip all our health centers to have what it takes, so that our people can get medicine. I think both have answered those questions. I don't know whether there is any question I've left.
Thank you. If I may chip in, I hope I'm audible, because I'm answering on the. But yeah, Bana Evans, am I audible?
Proceed, Waziri. Proceed.
Thank you, and thank you, Mheshimiwa Mwangangi. Now, the gentleman who asked about the laboratories is definitely a medical person, and I can tell that he knows what he's talking about. One thing he knows is the levels. There are various levels of laboratories. So even within the level 3s, we already have laboratories, and we are going to enhance the ones that are going to be in the model facilities. So it's not going to be a case of people leaving them and moving to the level 4s for lack of a diagnosis, because we are already providing laboratory services within particular level 3s. He knows that, and this is going to be enhanced within the model facilities. There are other services which can actually be provided quite effectively without the use of a laboratory. And any clinician what is training knows that is true. Looking at the maternity services, which is one of the things which really give our people a lot of embarrassment in the evening because of having to travel far, because maybe hawezi jifungulia ile hospitali iko karibu. Getting somebody through labor will not require a lot of laboratory service. So there is a lot of service we can provide 24/7 within a well-manned healthcare center. The healthcare commodities are basically have been a challenge, and yes, as Mheshimiwa says, we have one of our officers who has had to answer a case in court, and I will not discuss a lot because the case is ongoing. But it's good to reveal that as an administration, we have already taken the necessary action as stipulated in our, HR guidelines against a particular office. We await the closure of the case in court. So the system is helping us. Just to respond about the system that we have in place, it's helping us already pick. pilot studies, the pilot sites that we have, the 13 of them, we have not been able to roll it out, and our plan is to roll it out to the other facilities soon in the next financial year, so that now we can capture at minimum of 80% of the commodities that we have, we are going to have in stock. So yes, the system is useful. The system came in as a pilot. We already have our analysis of the usefulness, and we agree it's the way to go. On the issue of the model health centers, I think we have addressed that, and the commodities we have done. Dr. Kanyange, Dr. James Kanyange, where are you? Can you specifically address the distribution chain from KEMSA, either centrally or to the facilities? Are you in the house? Dr. Kanyange? Then Dr. Ndolo?
Yes, Waziri, sorry.
Oh, Dr. Kanyange, you are here. I want you
Yes.
to answer the question. There's a question which was asked, why take the supplies directly to the medical facility and from KEMSA and not centrally, then redistribute? Please respond to that.
Thank you, Waziri, and good evening, members. I think as a good practice, we encourage last mile delivery of drugs and pharmaceuticals.
Dr. Kanyange, I'm not sure we can hear you. Is he audible, or do we need to step in?
Somebody who can step in is disappeared.
Hello, can you hear me now?
Yes, they're back. Please proceed.
Yes. I was saying that just to mention that before devolution, we actually used to have a centralized system of delivery, and we really were getting a lot of damages and losses. And so, as a best practice nowadays, is that drugs and non-farms are delivered directly, what we call last mile delivery, to ensure that the integrity in terms of security and safety is maintained. And we are, that is one of the reasons that we prefer sourcing for the items from KEMSA. And when we cannot be able to get some supplies from KEMSA, maybe we go to meds as an alternative. But it's a good practice that we ensure that they deliver to last mile, that is to the user facility, instead, as opposed to a system whereby they will have to bring to maybe to the county, and then you will have to draw a distribution of where to take them. And in that process, you might interfere with the quality of the products, and also it will increase the risk of damages and losses along the supply chain. So it's a good practice that we must deliver, or we must ensure that they're delivered to the last mile, and that is to the user facility. And that is what KEMSA does. I think that answers it, unless there's some clarification.
Thank you, Director. Back to Evans, Moderator.
Thank you very much, Waziri and Director. You can see hands up from Amos. Amos, you can ask your question.
Nafikiri mnanisikiza.
Yes.
Swali langu nilikuwa naomba tu, unaona tukienda hizi mahospitali zetu unapata hii kulipa na M-Pesa. Sasa unapata kuna wale wamama wazee anasumbuka kule. Sasa mimi nilikuwa naomba tu Bwana Waziri, kama wanaweza tafuta wasaidizi tu pale, au wamama wakifika pale akipeana simu yake, sababu hata wengine hawajui mambo ya simu. Unapata mama anasumbuka pale, sababu siku ingine hata nilienda kwa hapa wote, nikapata mama mwingine mzee pale anasumbuka pale, ana mtu wa kumsaidia, watu wake wako pale. Lakini kungekuwa na mtu ameajiriwa na kaunti, wa kusaidia hao wamama, at least wangekuwa pia wanafurahia. Hiyo tu ndo nilikuwa nataka tu kuuliza waziri.
Sawa sawa. It will be answered. Muteti Junior.
Okay. Sorry. I had to talk about this. Honorable Mateso and Honorable Ben have their apologies because that is MCA Water and MCA Mbitini. They have been on and off. Mateso has a problem with the network from his side, and Ben is traveling, so I think he's driving. So he has some technical problem. So I think the apologies are well received. Thank you.
We receive them. Bwana Onesmus Mutie.
Thank you, moderator. To Waziri and two other protocol observed. Good evening. Hello, you can hear me?
Good evening.
Good evening.
All right, my question is very brief and it is mostly concerning the issues of drug shortages. So I had someone questioning on the same. So I was asking, is there a way that we can have the shortages of drugs? We have the research that we know those which one are moving faster. Therefore, we can have backups before the shortages appears. And then my second question is what Amos has raised. We have those challenges that wamama wanakuja pale hospitali and then they are getting those challenges on the new technologies. So is there a way we can as well have those department of social workers, because I think they help a lot on the same. Thank you.
Thank you for that feedback. I think that is quickly picked, that we need to assist the elderly especially, and those who are not able to use the new technology. The new technology is good and it's going to help us in many ways. We appreciate that it's coming with some bit of challenges here and there. So we will move quickly to assist those who have, it's already happening, but maybe there is one or two who have been left out. So hiyo tutahakikisha imefanyika kabisa. Then the commodities, previously what we used to have was a generic way of ordering. So right now the system we are using from the last question is, and this again explains what Dr. Kanyangi was talking about earlier. Kila mtu ambaye ako hospitali ile ana manage anajua vile vitu zimetumika. So as the things are getting used, as the commodities are getting used, yeye mwenyewe ndiye ata generate list at the end of the month or at the end of the quarter as instructed. So kulingana na zile dawa zimetumika, kwa sababu tunajua the disease conditions coming from Booni are not the same necessarily as those ones coming from Kibwezi East, for example. The two areas are very different. So hatuwezi peleka dawa zote uniformly. So tunategemea na madaktari na in charges of hospitali wao wenyewe wa generate the orders, and that's exactly what we are put in place as a new way of commodity management. So yes, it's true. We have identified and we are in the process now of making sure that we purchase depending on the needs of the various facilities. A question about anti-snake venom. Snake venom was asked a little bit earlier. I think I did not respond to that. Yes, kuna dawa. It's only that hatutaweza kuweka dawa ya either ya hiyo ya nyoka ama ya rabies katika kila hospitali, every small facility, because many of them will probably just expire. So we are going to use what we call, and this is something which I should have mentioned a little bit earlier, what we call, and Mheshimiwa Mwangangi alluded to it, what we call our primary care networks. The primary care networks itakuwa kwamba kuna hospitali kadhaa which feed into one particular hospital, and we are hoping the model health center that will be in every county will act as the hub for that health center. So ile kwamba we can have the essential supplies in that model health center including the anti-snake venom, including the anti-rabies, hizo za kuuma na nyoka na kuuma na mbwa zinasambazwa kulingana, kwa sababu ikipeanwa kwa motorbike from one central place in the sub county, hawezi chukua more than 1 hour kufika even the farthest place in that ward. So hiyo ndio plan ambayo tuko nayo na tayari imefanyika to a certain level. Kama uko Kibwezi East tukipiga Kibwezi hapo Amref, ama kama uko Kibwezi West tukipiga Makindu, utapata hizo dawa za rabies ama ya kuuma na nyoka. Thank you.
Mark, I think you had.
Yes. Thank you, moderator. Now, my interest would be, personally, I have been a victim of circumstances. In various occasions, I think someone is making some funny noise.
Albanas Mutula, mute your mic. Yes, proceed.
Thank you. Now, Daktari Waziri, and Bwana Kanyange, you have spoken of what you have concluded as the most efficient supply chains. But you see, I'm wondering if indeed doctors from the other centers or the dispensaries do not order medicines directly to KEMSA or meds or whichever other source. Why don't you find it probably efficient? Because at least you have said that you are utilizing a new system that has been introduced into the hospitals. Why don't you find it even much more efficient to have the distribution from a focal point? And that is water, for example, to serve all the sub-counties. In this way, and I'm speaking from a supply chain perspective, when you have these medicines, for example, distributed from or brought from KEMSA to Wote, other than KEMSA delivering the same to Mutito one day, they have to deliver to Tulimani, they have to deliver, I don't know to where, even as much as it's a cost-cutting measure on the side of the consumer, who is now Makueni County and the hospitals. It is much more efficient if indeed KEMSA drops all the medical supplies that has been requested by the various facilities through the headquarter, which I'm sure is the procedure, to the county headquarter. And then immediately, information is relayed to all the sub-county hospitals that medicines have been dropped to the county headquarter here. Please arrange on how you can collect your consignments. And then the system puts into track all the medicines that are to be distributed or have been released to the various hospitals. In a way, you see, when, for example, you have a situation where a hospital facility is getting supplies late at 7:15, I am sorry to mention, because I witnessed a receipt of medical supplies in a dispensary at 7:15 in the evening. I never want to say it where. And then at the same time, you also hear within 2-3 days that medicines have been exhausted. You cannot even get some basic painkillers. Just like I had a case of last week whereby a patient told me that I just need to pay for them some medicine through M-Pesa in retail medical, what do you call it, chemist, for them to just be facilitated with some painkillers. Now, what is that? So that is where the challenge of the supply chain comes in. And by this, I am saying, because I personally have interest in supply chain and I find it as an efficient way of doing things. Medical supply chains for Makueni County probably would be much more better if we have it centralized. Then through the system, we're able to track issues being made from the central focal point, at least for the other facilities in the outside to get whatever that they require, timely and much more efficient than even having maybe the facilitators or those distributors or issuers of medical supplies like meds and the others doing it from by themselves. So it's much more efficient, and I would wish Daktari and your team you look into that. You find it a way.
Thank you.
through
And
which we can have
Bana
Thank you.
Evans, moderator, allow me to make a suggestion. This is Wazir. Allow me to make a suggestion. The gentleman who is speaking seems to be an expert in supply chain management. And we may not be able to articulate all the issues that is raising in the current audience that we have, and we could actually end up boring a lot of them. I have sent you Dr. Kanyange's number, Evans, in your WhatsApp. I want you to link Dr. Kanyange with the gentleman, and I'll be happy for them to have an in-depth discussion on the matter. And I'll be
Thank you,
waiting for
Dr.
the I'll be waiting for the feedback from the two of them. Thank
I'm
you.
available, Dr. and Dr. Kanyange and Dr. Ndolo. I'm available. We share that. Thank you. Thank you.
Thank you. Thank you. Thank you for understanding. Thank you.
Thank you, Waziri. So, brother, we'll have to check my number there on WhatsApp so that I can share the same with him.
No
So,
problem.
brother,
Thank you.
Yeah.
Thank you.
Get my number there, and I will share. I think I want us to finish this discussion by 22:30 because of public demand. 22:30. So let us be brief on our questions. So just in you can hear your issue, and then we go to Kapita Duncan. Kavita Duncan.
Oh, I thought the center was to speak first.
Yes, please, I think Jacinta.
Okay, thank you, Bwana Director. Good evening, everyone.
Good evening.
My name is Duncan. I am calling
Good evening,
from.
Kavita.
Yes, thank you for. I must say a lot of thanks to the facilitators of this function. I never knew we had gone this far as a county. I think this is the first one. I really appreciate and call on my colleagues also to appreciate this. This is a very noble step. A forum where we can meet and discuss, even when we cannot see each other or we can. I really appreciate.
Go direct to the point.
Okay, my question is very simple, and I'm calling from Thwake Dam. This is where I'm working currently, and I want to raise a concern about the health facility that is within the project. It has gone for as long as I can remember, more than months now without drunks. And you know, when people were here, now they are not there. Of course, they have gone home. The project has stalled for I don't know how long. But I want to ask whether the minister or the governor are aware that the health facility is blank, I should say. And this is a very dangerous area, if I can enlighten a bit. So many snakes. This is a snake-prone area, like the phenom that was mentioned earlier. I don't think it's found within this area. Leave alone to mention these simple drunks. The whole facility is blank. If the county government and the minister have anything to chip in, do you have anything to do with this facility, or it's a national government issue? Thank you. Sorry? Am I audible enough?
Bwana Kavita.
Yes.
I will set a team to the health facility tomorrow.
Okay, thank you. Thank you.
Thank you. Evans, can I go?
Proceed.
Yes, there is an issue about the conflict, or rather the challenge we're getting, where we have private health facilities vis-a-vis the public. The private ones is like they are suffocating the service delivery in the public hospitals. And a case is Matiliku, where I'm told those people, they never see medicine. You get the supply, the people are always complaining there's no medicine. But the clinics which are in the market and also the chemists, they are well stocked. And I've never understood why even the people prescribing the drugs in the hospitals are sending you to specific places, go and buy this medicine here. Now, Bwana Wasiri, I can see you are online. There's an issue you need to deal with, and I look at healthcare like the way the police work. If you keep officers in one place for rather too long, they create their interest and they network very well and they do business. I followed up on the issue of Matiliku, and there is an outcry that there are some officers who have been there for rather too long. Can people move around? Ilatwa tweyawa kwa mwalimu ni school. Nayo kwa ndakitali kutwike hospitali. Can you look and see where many, especially the senior officers, have overstayed in some places and they get reshuffled like immediately because the public outcry is now raising eyebrows and saying, these people have been here for too long. They are the ones who know where our medicine is going. Can people move around because they are all supposed to be serving in the whole county? Thank you.
Thank you. What was that?
Thank you. I think that is the point from Jacinta is fairly straightforward, that we should endeavor not to keep officers for too long in particular facilities because they tend to develop some peculiar behavior and begin maybe to own not just the facility but the town, and that is well noted. If specifically Matiliku has some issue, I will immediately ask for an audit of the staff, and if I need to take action as recommended, then I'll do that. Of course, without destabilizing our people too frequently, because we are also human and we have some other aspects of our life that need a little bit of stability. So this is not something I'll promise to effect tomorrow. Kuna mama hapo ako na watoto wako shule, kuna mwingine hapo ako na one or two other things. But yes, when we find that there's need for an officer to move, we have ways of making sure that they move. This will happen.
Thank you, Waziri. I think I'm taking the last question from Onesmus Kioko and Onesmus Mutie. You be brief, each at least 30 seconds. Air your issue. It be responded. We move to the next, now final stage. Let's start with Onesmus Mutie.
Before before you get the other question, we don't have a public facility within Twake Dam, so I'll want the number of the gentleman who said the facility is blank, the one inside the dam. I don't know whether it was the one inside the dam, I mean the premises, or there's a facility that he was referring to, which is neighboring the project, because that's the one now I can send my officers to visit.
Yes, I'm around. I can hear very clearly.
Kavita?
Yes.
Is the facility inside or outside?
There's a facility inside the project.
So we need to get engaged separately because we don't have a public facility inside. But
We have had your officers have been here severally, so they know about it.
Sawa. We'll be getting feedback tomorrow.
Okay.
Onesmus,
all right. We must acknowledge that the Department of Health in Makueni County is doing a great job. Then my question is closely to what Jacinta was speaking about. Do we have data on those maybe those shortages of drugs? When reports are coming back to the headquarters, do we have like if cartons of 20 were taken to maybe in Matiliku sub count, that is in that hospital facility, do we have a data that is showing such amount of drug was used against to such patients, so that we can do a better monitoring on the same, so that we may not keep on complaining drugs are being misused, for example, to that is my question. Thank you.
Yes, we have systems and tools of reporting back to the county headquarters the utilization of our commodities. It might not be as real time as we would have wished, and that's why now we are in discussion with ourselves and the top leadership in the county to ensure that we can acquire a system that can actually upload or rather update the utilization and the status of the levels in a real-time manner. This is something which is already happening in some of the facilities that you visit, the ones which are not really limited in terms of resources. But it's somewhere we would wish to go, and we will endeavor to get there not so far from today. Probably even in the future, we can, like the gentleman who was asking earlier, in terms of the supply chain management, we can probably find a way of interfacing with our major suppliers to ensure that even as the commodities come in, the system picks them up automatically. I think at this is something we can do. This is something we have ability depending on the availability of the resources. So thank you very much, and I have to thank Bana Evans, because at this point in time now I will request that you excuse me. I will I think it's 10:30. I'll be getting into somewhere where I'll not be able to engage effectively. Thank you, and God bless you, and we'll continue to engage within the community. Asanteni.
Thank you, Waziri.
And we really appreciate your department for coming in this crucial discussion. It's a very bad issue, and your discussion is really important because of enlightening the public on what it takes. I would request James Kanyange to give a vote of thanks from the department side, and then also request Jacinta Kimuyu and Muteti to give vote of thanks from our side of planning of this particular noble discussion. Then Bosco will close with a word of prayer. So, Daktari James.
Thank you, Evans. Thank you for hosting us. We really appreciate the good feedback that we are getting from the public, and we look forward to more partnership with you to take your service delivery to even greater heights. Thanks a lot.
Asante sana. Jacinta.
Thank you so much, Evans. On behalf of the organizing committee, we are so glad and overwhelmed by the response. We are glad that we called this meeting and the response was good. Waziri coming on board together with his team, full team actually, it was quite a good gesture on the commitment the county government has on the health delivery to the people of Makueni County. We, the people, we are happy and we continue praying for you because we are looking forward to better service delivery in the area of health. When you have healthy people, your problems are less because health is key and the people become more productive when they are healthy. Thank you.
Thank you very much, Jacinta. Muteti Junior.
Yes, I would like to take this opportunity to thank everyone for coming on board. Moso on our team, that is the technical team that was working on the arrangement of the meeting. And maybe on the other side of the public and the county government itself. We have seen a lot of commitment from our people because information is power. They have been sharing information with us. The county government is receiving the information wholeheartedly, and we are sure they are going to gain something so that maybe we can change our county. The agenda is to change our county. So we are going to engage on more departments to ensure that we work closely with the government to help our leaders and maybe its leadership to deliver to our people, so that maybe you can see changes. So I say thank you to everyone, and I invite you to our next meeting, which is going to be communicated to you. Asanteni sana, and God bless you.
Thank you very much, members. We look forward for more engagements, more discussions. I think we have very many issues as the public. So I wish you the best. A good night. Bosco, you can close with a word of prayer.
Okay, thanks everyone for joining. Thanks our Weshimio. We can pray. Our Father, we thank you for this far you have brought us to the end of the meeting. Thank you for welcoming our leaders on board. As we prepare for the next meeting, be with us, our Father, with us in the new week and in every work we are doing. Father, we thank you for our county, Makueni, as well for our leaders. Be with us in this night. In the name of Jesus Christ, we pray and I believe. Amen.
Amen.
Amen. Amen.
Guys,
Thanks, everyone.
Good night, guys, and bye.
Good night. Bye bye. Thank you.
Good night.
Bye.
Good night.